right. Well, I'm gonna get going if that's okay. Yona, Irfan, and Rebecca and Megan, is that good? Yeah.
Good.
Okay. So, we really want to thank you for joining us this afternoon or this evening, depending on where you are in Canada. And it's so nice to see. We can't see all of your faces, but we can see many faces. And we thought we set up the meeting like this on purpose because we thought in this time of distancing and social isolation that seeing each other's faces would help us to better connect and maybe feel a little less alone at this time. So COVID-19, we've been hearing that a lot, and COVID-19 is certainly reshaping all our lives. There's a lot of concern. If you heard the chat that I was just having with Laura quickly at the beginning, there's a lot of anxiety in the disability community about how this crisis is going to impact people with intellectual and developmental disabilities. And while parents and professionals are struggling, I think it's also really important to recognize that siblings are struggling too, that it's having an impact on us. So this crisis is really transforming our relationships with our siblings. It doesn't matter if you see your sibling every day, if they live locally or halfway around the world. COVID-19 is really changing how we're interacting, and it's bringing up a lot of emotions and feelings, and thoughts even perhaps about future care, like who's going to take care of my sibling if our parents become ill and are not able to care. So, that there's a lot of difficult feelings that COVID-19 is bringing up. And we're hoping today that this discussion will help you better navigate these stormy waters. The way we thought to do it would be to have about 60 minutes of discussion. And then we're going to do 30 minutes of Q&A. So the way that we're going to do the questions is you can put them in the chat box, and Megan is going to moderate them for us. So that's how we're going to proceed today. And I wanted to introduce those of us that are speaking. So Yona, do you want to introduce yourself first?
Sure. Hi, everyone. I'm just demonstrating how you mute or unmute your microphone. My name is Yona Lunsky, and I direct a research program at CAMH focused on mental health and developmental disabilities. And I also run a program just focused on health and developmental disabilities called HCARD. And today I needed to put on my Special Olympics jacket because the last trip I had was the amazing National Games, which was such a time of actual face-to-face unity of people from across our country, really just celebrating disability and teamwork and being together. And there were amazing families, brothers and sisters. And I needed a little bit of teamness today, so I put on my Special Olympics jacket. When I'm not busy at work, I'm also the youngest sister in a family where my sister, who's 3 years older than me, has a developmental disability, and I'll talk more about her situation a bit later.
Great, thank you. Irfan, do you want to go next?
Sure. So hi, everyone. My name is Irfan. I'm a recent graduate from medical school, just June of last year. So medical graduate and currently working as a research analyst with Yona at the Azrieli Center. I'm also involved in sort of the HCARD program and all that fun stuff. And then from a sibling perspective, differently from Yona, I'm the oldest of 4 siblings. And my youngest brother is a 14-year-old with autism. And again, we'll talk a little bit more about that later. But so excited and happy to be part of this panel. Yeah.
Wonderful, thanks. Rebecca, you're up next. Oh, you're on mute, Rebecca. There.
I should have followed your good advice, Yona. My name is Rebecca, and I'm so happy to be here with you today. I'm coming to you from Vancouver, and here I work with a group of people with disabilities and their families in an organization called Planned Lifetime Advocacy Network. And on a good day, before all of this happened, we've been studying and practicing how people can work together and stay socially connected because of all of the other barriers that make us isolated. So with the current situation that's going on, obviously that's now a million times more important. So I'm happy to be here to share some of the things that these families have been learning for the last 30 years and just how relevant they are to what we're facing now.
Thanks, Rebecca. And my name's Helen, and my brother Paul lives with me here at home in Ottawa. He came to live with me and my husband maybe 5 years ago after our parents passed away. He's a person with Down syndrome, and in the last 3 years, he's developed some really challenging physical disabilities, so we have that too. And when I'm not caring for Paul, I run an independent consulting practice working mostly in the community sector. And I'm also the co-director of the Sibling Collaborative with my partner, Becky Rossi. And I think about siblings and this journey that we're on all the time. I think it's a really critical role, and it's an unrecognized role, and really important to the long-term well-being of people with disabilities. So also I think we should just quickly introduce Megan. Megan, do you want to say hi? Megan's going to moderate.
Hi, my name is Megan. I'm a research analyst at CAMH. I work with Irfan and Yona. I do a lot of social media communications and tech support for a variety of projects, and just really excited to sort of see how this is all going to unfold. It's a really interesting time for us all to connect, and thank goodness for technology. Yeah. So I'll let you guys get to it.
Thanks goodness for Megan when it comes to technology. So thanks, Megan. All right, I'm going to turn it over quickly to Irfan, who can maybe give us a little bit of an overview of what's happening in Canada with COVID-19.
So just sort of briefly going over some of the stuff that's happening right now, and some of this will seem familiar, but again, just want to reiterate some points. Obviously, this is a difficult time for everybody all over the world with COVID-19. It's a virus that's been spreading much faster, and then a lot of other viruses that are more sort of seasonal, like the flu and things like that. But yeah, as things stand right now in Canada, we've got, when I last checked, at least we had about 7,700 cases across the country. And from a fatality rate, looking at close to 100, so about 89 to 95 were the numbers that I was seeing last. So again, this is affecting everybody far and wide, quite intently. It's out there, and there's a lot of uncertainty at this time. I think a lot of people are saying that, like, oh, April 6th was the original date until things were going to be sort of, held off until, but a lot of recent news is suggesting that it's going to go on a little bit longer. But the messaging there, I guess, that we want to highlight is this is going to be sort of a marathon effort and not a sprint, which makes efforts like this really important around what can we do to support each other and help each other at this time to go through this. Because even though we may be physically distanced, and that's what the advice from the government and public health is, we still want to be socially connected to one another to be able to get through this time, because together we can do this. So from a health standpoint, symptom-wise, the biggest symptoms of people with COVID are coughing, a fever, and shortness of breath. There are some other symptoms that are a bit less common, like headaches or muscle aches and things like that, but those are the three top symptoms. Originally, there was a lot of concern around travel, but I think this has gone beyond people who have traveled. I think those people who are also not traveling are now starting to transmit or get the disease. Again, advice from the government and public health agencies across the country are really suggesting a lot of physical distancing at this time. That means not gathering in places where large gatherings occur. Most of those places are already closed. But a lot of good hand hygiene, regular hand washing, and again, keeping gatherings to a very minimal and staying within spaces where your immediate family are the only ones you're sort of gathering with and interacting with. And any travel is only essential, so that's to get groceries, medications, or very urgent requirements that you need to go to the hospital. Another point I'd like to make around healthcare really quick is that to continue accessing your primary care is very important at a time like this. And I think technology has really been helping in that regard as well. A lot of doctors have moved towards doing things online and doing things virtually. So a lot of doctors' offices, you can now connect with them online and have online appointments from the comfort of your home, where they'll be able to still provide some guidance and some advice as to next steps, be it a COVID-related or a non-COVID-related issue, even if it is renewing your medications, various different issues. A lot of that can now be addressed online with the doctors, mailing prescriptions to your pharmacies, and avoiding that interaction face-to-face, but keeping it virtual so that you're still able to tap into that resource that is your primary care providers, to be able to still continue to care for you. Because again, even though COVID-19 is a health issue that's come up, all the other health issues don't stop. We know that they're still existing and they're still there. There's still concerns. And even if that means just checking in with your primary care doctors, that's important, especially for people in the developmental disability and autism sort of world. We do know that they have more sort of healthcare needs and more challenging healthcare needs. So I would just want to empower people to still be able to reach out to their physicians. It might be a different format and different way of doing things. And it's scary, it's different, but look for resources to help provide that support at a time like this. And we're happy to sort of provide that support on and off basis. And we'll discuss a couple of resources later on. So that's sort of my overview in terms of the healthcare situation right now, but we'll talk a lot more about tips and stuff a little bit later.
Super, thank you. So one of the reasons that Yona, Irfan, and I decided to present together is that the three of us have very different sort of situations in terms of our siblings. So we thought that it might be interesting for you to hear about our particular situations, hoping that one of the three might relate to you. So Yona, would you like to start off first with you and your sister?
Sure. So as I said, my sister is 3 years older than I am. So she's just over 50. So now you guys know how old I am. I think she's 51, I'm 48. I say that because, some of the research that we've been doing for a long time in the H-Card program, we've been looking at healthcare in this population. And I guess a really important point about my sister that really kind of hit home more recently is we've been saying for a long time that in the developmental disability population, people are 80 at 50 because there's sort of like premature aging or frailty kind of starts a bit earlier. So when we think about some of the challenges that older people experience in the general population, it happens at a younger age. And I knew those facts and I didn't think about it because my sister wasn't 50. And then all of a sudden one day my sister was 50 and it was like, holy crap, my dad's 80 and my sister's 50. And now she's got healthcare issues we never had to worry about before. So she's kind of actually, even though she's not older, she's old enough with her disability that I think there's probably more that I would worry about than I would have maybe 5 or 10 years ago in light of what's going on with COVID. So I mentioned that my father is in his 80s. My mom also is older, and they live separately with partners, but they're both kind of self-isolating for the most part right now. They're pretty much staying indoors. I haven't seen them. So obviously they haven't seen my sister. My sister lives in a group home setting. And for those of you not from Ontario, we have about 300 different developmental disability agencies in Ontario. We don't have like 3 agencies, right? So everyone's got slightly different rules. They're all trying to follow certain rules that are coming out from government, and sometimes there's new rules every week, every day, but exactly how they do them is a little different. So right now what we're doing in Ontario for people who are in group homes, for the most part, is day programs and that kind of thing have been canceled for, I guess, over 2 weeks. And some residences came out and said right away, like, no visitors, period. If you take your family member home, that's where they'll be staying. They can't come back to the group home setting. In my sister's situation, I've had sort of the approvals or the okays to meet her for a walk. She doesn't live that far from me. So we're sort of taking a walk almost every day. And we actually have a really long stick. I can show you guys a photo later, which sort of matches the broom length, right? So that she doesn't, because she's a big hugger, so that she doesn't come to give me a hug and I feel like I'm still keeping her safe by maintaining that physical distance. So I am able to see her. I'm super grateful for that, especially I think because my parents can't see her, and she's not doing that much sort of throughout the day, I think, where she's living. But she's also, her staff are still coming into work, and every time I call and they answer the phone and I recognize someone, I thank them, and I probably get kind of teary. I'm super appreciative that she has familiar people with her right now, and nobody's sick where she's living right now. So she's safe, and I still get to see her. And I'm also kind of, I guess, a sort of a liaison between her and where she lives and my parents. So I think this whole thing's pretty overwhelming for my parents, who are older and scared and dealing with health issues. So I'm probably more involved with what's happening sort of day to day, hour to hour with my sister. And I imagine if anything happens, it will be me who will be very involved in terms of her health care and that kind of decision making.
Mm-hmm.
I think that kind of sums up my situation. So I don't live with my sister. I thought really hard about, not that we had a long time to think about it, but I thought about whether she would come and live with me over this time. And part of me really wanted to have her close and wanted her to just come over and we could watch movies together and have fun. But I knew for myself that that I have 3 children, and there's a number of different needs and things going on in my household. Plus, I'm working really hard full time trying to do work related to this pandemic. And I knew that it might be hard for her to be out of her context and all of us kind of supporting her at this time. And I also knew that if she came to live with me, that she wouldn't be able to go back to where she was. So I made the decision, and it's a personal one, that she would remain where she is for the moment.
That sounds really tough, actually. But thanks for sharing that, Yona. I thought I'd share a little bit about what's happening in our house. So as I mentioned, Paul, my brother Paul lives with me. And by the way, he gave me permission to tell the story about our life together right now. So Paul, told you earlier, he has a number of physical disabilities that have come up in recent years. So Paul's a perfect example of that. 50 at 80, he's not quite 50, but he sure has the physical health of somebody who's 80. And because of his physical disabilities, we have had in the house a lot of support. So we have personal support workers who come every morning and every evening to help Paul get ready for bed. We also have a number of supported independent living workers that help Paul to have, you know, his own life here at home, where he can be a roommate instead of somebody who needs only care. So he contributes to our home. And then one PSW came through one day about a little over 2 weeks ago, and he said to me, "Oh, I don't believe in this COVID-19 thing." And I thought, oh no, okay, let's shut this down. So unfortunately, I stopped all the PSWs coming through. And then the supported independent living workers, they're with a disability organization here in Ottawa called Live Work Play. And Live Work Play decided on their own, I guess, because of the public health warnings, that the supported independent living workers would stop coming to see the people that they support. So all those supports stopped. Life came to a screeching halt. And what that meant for me is that I have ended up providing my brother with a lot of support. And he deeply resents that. And I really understand that, because I deeply resent it too. So I'm very vocal about the fact that I don't enjoy being a caregiver. And it's really hard on us both to have nobody helping us. And then on top of it all, of course, all Paul's activities have stopped, and he's at home and needs a lot of attention that typically a SIL worker would give to him. And I'm in the meantime trying to work. So there's a lot of pressure, and our relationship has kind of changed. I mean, well, it has changed. We've gone from being brother and sister to being, sibling and caregiver. And he knows I don't enjoy it, and he wants his own independence. So he's doing everything himself, or he's trying to do everything himself, which is really hard on him. I'm trying to respect that, but at the same time, when he's not looking, make his bed or fill up his CPAP machine or something like that. On the plus side, he sees me and my husband online so often, working like either through Zoom, and my husband works on Google Hangout, that he's really embraced this online thing because it's so normalized in our house. And he's actually taking music lessons. His music teacher has moved online, so he's been doing music online twice a week. And Live Work Play has been running chat rooms for their members online, and the SIL workers have been doing one-on-one support online. So he's really embraced that, and so that's a positive. But yeah, losing the support and that change in our relationship is really difficult, and generates a lot of tension. So, Irfan, do you want to tell us about your situation?
Sure. But I just want to say that, that change of supports definitely sounds like a situation that's not an easy one to go through. And that's what COVID's done to people, right? It's taken a situation and turned it on its head, and everyone's going through this chaotic process of finding their new normal, whatever that is, and for who knows how long, right? It's that uncertainty piece that we're all sort of trying to boil through and figure out and find out what our new normals are. But it's nice to also hear that okay, there's some great positives in that, how he's embraced the technology in that sense. A little bit of a double-edged sword in that regard. But speaking about myself, I guess, so like I said earlier, my youngest brother, who's 14, he lives at home, but I don't live at home. So I live in Canada. My parents and my siblings live in Kenya, halfway across the world. And my brother's at home with my parents and my two other siblings. And it's been interesting because Abbas is my brother's name. He is a very routine-driven person, as somebody who with autism would be, and loves going to school. And obviously that's not been going on for a little while. So what does he do at home all day has been a bit of a change. And it's been interesting to see that, he typically spends a lot of time watching YouTube videos on his computer, so he's quite okay with using technology. Again, he has that element of being younger, which lends itself automatically to that in some regard. But yeah, that sense of a routine of okay, things to do, having getting ready in the morning, going to school, coming back home, that sort of has been disrupted in some regard. But I do give some credit to my siblings, my other siblings, who've sort of taken on a role of being okay, let's be there for him and do some things with him. So something that my sister started doing is taking him outside for walks. And they actually live in an apartment building which has a roof terrace. So they go on the terrace every evening before dinner, and they'll do a little bit of a walk, but they'll make sure that they're staying away from other people. They actually don't go downstairs at the basement of the apartment in the parking lot to do walks, which is what they normally would do, but go upstairs because there's fewer people upstairs. So making a couple of changes in regards to the situation right now, and doing some of those things. But even in the house, they're trying to maintain a new set of sort of routines for him, like getting him to help with laying the table, and doing a bunch of different things. Abbas, another thing about him is he likes his physical activities, especially something that he loves is swimming. And that's something that obviously he's not been able to do over the last little while. And I think something that my mom was telling me was that the sensory piece, I think, is really big for him, because people with autism have different sensory needs, and that feeling of the water on his body is something that he really enjoys, and a little bit of that pressure sensation. So something that my parents have sort of figured out is very recently they were able to acquire a massage chair at home from my grandparents, who were sort of moving houses. And so that's something that he's really liked, that sort of sitting in that massage chair and getting a 10-minute massage where his legs get squeezed and his arms get squeezed and his back gets a little nice rub. So getting some of those different sort of changes and things in he really enjoys. But you can see, I don't know, my mom was telling me a story yesterday that she was running a couple of errands 2-3 days ago, and he went along with her. She decided like, okay, let's go for a ride in the car because you're just going to be at home watching videos. Let's go in the car. So he came along in the car, but everywhere she made stops to the shops to pick up a couple of different stuff. Somehow he was like, no, I'm just going to sit in the car here. So he and my dad were sort of just in the car. He didn't take his seatbelt off. He was just sitting there and was waiting that like, okay, like, no, even though he's nonverbal, he doesn't say much, but he understands a whole lot. And somehow he's sort of, I think, picked up that like, okay, going out is not the right thing to do right now, the best idea. Somehow he's either picked up on that vibe or that conversation, and was like, okay, I still got my outing. I was not at home all day, but I'm just going to stay in the car because this seems like the right thing to do. So that was a nice, interesting story that my mom shared with me, and I thought I must share with this group as well because it's so relevant. But yeah, so a lot of changes again, and everyone's trying to figure out the best way to deal with those changes.
I want one of those chairs. Those massage chairs. It sounds great. Thank you for sharing.
I recommend, yeah.
I appreciate hearing all of the different experiences that you shared, Helen and Yona and Irfan. And I have a feeling if we had 4 hours, all of you on the call could go through and share such interesting stories of how you've made it through this first few weeks. Some of the things that stood out to me from your stories is that life a month ago and the challenges that we face then haven't gone away. We still have competing priorities in our own lives, the work that we do. A lot of you as siblings caring for your parents who have their own aging and healthcare needs, and now your brothers and sisters, and the added challenge of not being able just to show up and say, hey, my brother can come here for the weekend or my sister can stay here for a bit. I think that there's this whole new level playing field that we're all working on and trying to navigate those challenges with something that's big and unimagined. And I'm really inspired to hear the stories of creativity and resilience from people like Paul jumping in on the music and being willing to take his music lessons there, and the walks and the sticks and the drives. And I really hope that in this call today with all of you here, there'll be a chance to share, first of all, knowing that you're not alone in what you're experiencing, but also that when we work together and when we talk about what's going on for us, then that helps make the journey a little bit easier. So thanks for sharing your stories, and to your brothers and sisters for letting their stories be shared.
Thanks, Rebecca. So now we know a little bit about the varied situations that we're in. What are some of the things that we can do about it? So we thought that we could share our different solutions or ideas that each one of us have been working on in our own situations. So I'd like to go back to Irfan. Are you? Yeah.
Yeah, so I think like I guess like sort of the theme that I was sort of going to focus on was more around sort of physical health and how we've managed to sort of keep up with that. And I think there's a bunch of things, like when someone says physical health, I was thinking to myself when I was going to talk today, is like, what does that mean? And I think that means in some way doing this, trying to maintain the same routines from a physical standpoint, from an eating standpoint, eating and drinking the same things and maintaining your same healthy habits. Of like, yeah, having the same types of foods. Again, a little bit more challenging right now with like, especially for people with developmental disabilities on like, for those who are more independent and used to getting groceries on their own, there's sort of limitations around that. So what do you do in those regards? So I think as siblings as well, we're like, okay, we want to be the ones to help out with that, because people with developmental disabilities are sometimes more vulnerable from a health standpoint. We don't want them going out per se. So, offering to help with the groceries, but minimizing those grocery runs to that once a week and having some good planning around, okay, these are the meals we're going to make, and so this is what we need and this is what we need to get. So just having a little bit of a structure around sort of some of that. So from a meal standpoint, and then from a physical activity standpoint, something that I'll share is like, you can still, as things stand right now, and obviously this situation is changing fairly fast, But as things stand right now, we're still able to go outside. And for those people who like to still do that, we can continue doing that. And we've had some good examples, the way Yona shared how she was going for walks with her sister, or how my brother goes for walks with his sister as well, while still maintaining that social distancing, and avoiding some of that sort of the risk that comes with going outside, or mitigating that risk, or sort of doing that in a way that still allows for that external going outside and doing those activities. Another way to keep fit that has come up recently, I think for everybody, but like more pronounced even for the people in the developmental disability world, is online videos. So this is a suggestion I'd even provided to my family members that, like, okay, if you guys can't go out that much, maybe all of you should just hook up, the TV to one of these YouTube videos, which has some physical activity, and you can watch with the video and follow along and do those same exercises. I know there's some great developmental disability based YouTube channels, for example, Special Olympics. And again, we'll be sharing some of these resources at the end today. Has a great selection of videos from and different levels of sort of from like low, moderate, intermediate experience, like sort of different levels of exercises that people can do. And that might be a great way if you're living with if you're living with your siblings, that might be a great way to sort of, engage in some physical activity together while still maintaining that physical distancing and not going to the gym or to the other programs that obviously like people have lost access to, at least intermediately right now. So maintaining those same sort of habits as much as possible, trying to keep a routine. Again, like with my brother, that's what we're doing, trying to maintain those routines and getting him to help out in different ways as possible. Is some things that we've been doing. And just to wrap up on my physical health sort of little piece here, I think, again, I just want to, I think I said this a little bit earlier, but like reaching out for help when it comes to health related needs. I think with technology nowadays, we can really continue to provide healthcare and access healthcare, even if we can't do that physically. Like a lot of things have moved virtually, and there's the capacity to do that. So making sure that if we are concerned about certain healthcare needs for ourselves as well as for our loved ones and our siblings in these situations, to reach out for help from other family members, just if it's just a listening ear and just some advice on, what should I be doing in this scenario, to people like your family doctor or primary care, and saying that, like, okay, these are my concerns right now, whether they're COVID related or they're not. So continue to access those resources, maybe in a different way, but that's still a resource that exists, and that should be used.
Thanks, Irfan. Actually, that's really interesting about going to your family doctor. I have been, in my mind, it's always there that we should just be super careful and nobody should, stuff any marbles up their nose or anything like that, just because we don't want to end up at the doctor's. But it's true that that now there's the online option, and I forgot that. So that relieves a lot of stress just hearing that, I have to say. Yeah. So Yona, can you tell us a little bit about, some things that we can do around mental health?
Yeah, so I'll try to weave together, I guess, some general stuff on mental health with kind of my own personal take on it, because this is a personal webinar. I guess my first point is, at CAMH we have a slogan you might have seen in recent days: mental health is health. So it's kind of recognizing that, our mental health is just as important an aspect of our health as what's going on right now in terms of whether we get COVID-19, right, or we have other kinds of physical health conditions. For us, and certainly like for my sister, or for people with disabilities, so much of what goes on that can cause a lot of difficulties is related to mental health. So we know that adults with developmental disabilities have really high rates of mental health problems when this isn't happening. So, it's really a difficult time for people who love their routines, as people have said here, to really lose their relationships, their connections, the things they do, the structure, and then to have this like uncertainty that we're all feeling. Whether we say we're feeling it or not, I think people know what's going on, even if they don't understand it fully. So I would say, certainly for my sister And for a lot of the people that I work with in my daytime job, this is a huge issue, you know, how this is going to impact their mental health right now and how it's impacting our mental health. We have a nice resource page that CAMH kind of built pretty quickly. And again, we'll share the links and stuff at the end with a lot of resources for all of us on mental health in this time. And I'm proud there's going to be sort of 3 more sheets kind of going up in the next day or two, sort of specific to our population in mental health as part of the CAMH website that we've been working on. So I think information is a helpful thing for mental health. Knowing kind of what's going on, knowing how to deal with things can sometimes help. Knowing that what we're experiencing is quite expected given what we're experiencing sometimes is reassuring or helpful. But I would say at the same time, information is actually one of our mental health problems right now. So I don't know how much time each of you have been spending on social media, on watching the news. It's not very good news most of the time. And so first of all, we're like super alert. Like my sleep is a bit thrown off right now. Some days I go to bed and I have like the best sleep and I wake up and I'm ready to go. And other days, like last night, I don't know, someone went to the bathroom in my household. Maybe it was 3, maybe it was 4, and I was just up, you know, so I eventually started my day around 4:30, 4:45. And that's really hard to maintain over time, not sleeping enough. So I think my anxiety makes me not sleep as well as I can sometimes. And also I sometimes will not, you talked about eating like as a physical health issue, but it's also a mental health issue. So if I'm really kind of hyper and my adrenaline's going and I feel like this is some kind of emergency that's happening, I might also not feel very hungry and I may not eat or I may not be drinking enough. So I try to remember every time I sit down for a meeting, and I'm having a lot of meetings in my job, to have water and to kind of count during the day to make sure I'm drinking enough water. So yeah, but going back to the media, it can be overwhelming for us and it can actually make us hard. It can make it hard to sleep. It can be confusing. And I think it also can be confusing if you have a brother or sister who watches TV at all, or who looks on YouTube or looks at what you're talking about and hears what you're saying. You know, it's going to be really anxiety provoking for them as well. So a really big piece of sort of general recommendations for all of us, and certainly for, you know, our siblings, is kind of calling it what it is. Like, this is kind of scary sometimes, and it's not clear how long this is going to go. We don't know how long this is going to go. That's hard. I find it hard that I don't know how long this is happening for. I miss my friends. So kind of like that validating, I think, of their experience and not being afraid to show that it's our experience. So one thing I talk a lot about when I think about mental health in this population is we're always trying to show them that things are really good. You know, you don't be sad. You know, well, actually they are sad. Don't be scared. Well, actually they are scared. We're scared. You know, I don't really appreciate when someone tells me, well, don't be anxious. Just, you know, have a positive attitude. It's like, well, damn it, I am anxious. Positive attitude comes later, you know, so helping them to appreciate that they can feel what they feel is really important. And I think for us, remembering also that we can feel what we feel, and that's okay too. One thing I've done a lot of research on in my day job, and I'm quite interested in this sort of practices like mindfulness practices, and kind of being in the present moment, being aware of what we're thinking, what we're experiencing, and sort of the impact that can have. And I think that those kinds of activities that bring us to right now, and you know, mindfulness isn't about feeling lovely or happy. It's just kind of noticing how you actually do feel. So I kind of say, like, if you've hurt your leg or your knee and you don't notice and you try to go play football, you could really be in a lot of trouble, right? So being present to what's happening in your body, but also being present to what's happening in your emotions kind of allows you to take care of your emotions in a different way. So I don't have to feel good because I'm mindful, but at least I'm mindfully aware of what I am feeling and what I am thinking. And then that helps me pause for a moment in terms of the reactions that I have, or also what I need to do today, what's going to serve me best in this moment. And I think that's helpful for us. I think that's helpful for our siblings right now. So that's one thing that I think can help us when life is quite chaotic. There's a short little video I'll share actually on coping that sort of talks about 3 stages of coping that I also find kind of useful or helpful. And maybe my last 2 comments that I wrote down that I wanted to say around mental health. One is, and we've kind of hinted at this a bit, Sometimes we talk about siblings in adulthood being a bit of a sandwich generation. So for some of you, you may have children. I mentioned that I have 3. I've got my parents, and then I've got my sister. So it's actually kind of like a double-decker or super club sandwich. Like, we're not just a sandwich generation. We're like one of those big, meaty, thick, kooky sandwich generations. So it's our mental health, but it's my parents' mental health, and there's a lot of anxiety there as well. And then my sisters and what's going on with my kids. So it's like all kinds of mental health stuff, and they all interact with each other, right? So if just one of those pieces is not quite in place, it kind of affects everyone else. So I have to hold a lot of that. And so I think finding a little bit of space or appreciation for that for myself can be helpful for me. And then my final comment is that, you mentioned sort of meetings with the family doctor, Irfan, and how important that is. And Helen, you're like, oh, I didn't really think about that. Not only is that so true for physical health, it's really true for mental health. So first of all, mental health is open for business. We are not open for you to come into our office or our hospital just to say hi, but we're also doing virtual mental health care. And primary care is hugely important at this time in terms of thinking about mental health, both your mental health and the mental health of your sibling. So we had a meeting this week, and we have regular proactive meetings to prevent crises anyways that include different members of my sister's support team and family, and also our family doctor. And I saw one of these meetings was coming up, and my doctor was like, well, we better cancel. We're not going to the doctor. We're not leaving the house. And I was like, they do virtual stuff. I don't think we should cancel it. I think we should take advantage of the opportunity that we have an appointment booked, and we can all be on the same page and have a conversation, and that will be really good. And it was a really good meeting. And we've kept our meeting for a month from now. So we're going to have regular meetings still, just as check-ins. So we're kind of all on the same page, and we're keeping tabs on things and trying to solve little mental health sort of issues as they kind of emerge, instead of waiting until we have a really big problem and we have to figure out and scramble sort of how to get mental health services. So,
yeah, tackling things as they emerge is, I think, a really important message as well, right? We don't want to wait till the end of this and then have something enormous on our hands that we have to solve. Thank you, Yona. Rebecca, you over at Plan, you've been doing lots of work on keeping folks connected. Do you want to tell us what you've been working on?
Yeah, thanks for the opportunity to do that. I'm really glad we talked about health and mental health, because those are things that are so deeply impacted by the times that we're in right now. And I think that it's so hard to be able to continue to respond when so many things are out of our control. The way that we typically have figured out how to mitigate these challenges all of a sudden are gone, and all of a sudden limited. The one thing I wanted to share about is during this time, something within our control is our relationships, and the way that we interact with each other, and the way that we care for each other, and the way that we support each other during this time. And at Plan, we realized that social isolation isn't something that's new for a lot of you and a lot of people who have disabilities. And so a lot of the work that we've been doing and practicing for 30 years all of a sudden is relevant to not only our loved ones, but for each one of us. And so we've spent some time trying to summarize what we've been learning, and we came up with 5 big ideas, and you can find them on the plan.ca website. And the first one says, don't wait to be asked. When it comes to building relationships and connecting with other people, now is the time to reach out and to not only offer what you can to help other people, but to say what you need and to ask other people if they can help. It's often very helpful if you as families can be clear and talk about the ways that other people can help you. But when it comes to building relationships, we also have a lot of things to give. So we've been saying, try and do every good thought that comes to your head. If you think about someone, everyone's at home now. So if you're thinking about them, give them a call or send them a text and say, hey, you came to mind today. I hope you're okay. Right now, there's an incredible amount of connecting and healing and relationships happening. And we often wait for an opportunity or a crisis, and this is one. And so if there's people that you want to connect with, we're saying don't wait to be asked, just do it, and you'll be blessed, and you'll see that people are responding, because we all need these relationships, and the relationships that we have become the building blocks for everything else and every other challenge that we're trying to encounter during this time. We're also saying, don't do this alone. Build yourself a team. And some of you are familiar with personal support networks. This is a different way of saying it. Right now, during this time, there's too much to do it alone. And so identifying 2 or 3 people who can navigate these times together with you, and just saying, hey, can you be part of my team? And making agreements about how you interact with each other. Maybe there's specific roles that you need other people to do, buying essential supplies or helping with the meds. Maybe you have a list this long and you just can't do it. Reaching out and asking people to be on your team is important. And everyone benefits when they're part of a network. And so I just want to encourage you, when you're reaching out to someone and saying, hey, do you want to be part of my sister's team or my sister's or brother's network during this time? Everyone now is looking for ways to connect, ways to offer their love and care and their practical support. And so now the one really practical thing that you can do is to build yourself a team, because I know we all live in different parts of the country. Maybe some people are tuning in from other parts of the world. But this crisis isn't over yet. And in some of our areas, we believe we haven't even hit the top of it. And that sounds even more scary and even more unimaginable, but we are going to need people. So right now, during this time that we have some time to think and plan, reach out. And ask, and then make some agreements about how you'll be together. Maybe it will be about sending an email every Monday where everyone's sending an update about what they've done. Maybe it's a private Facebook group where you're sharing pictures or recipes. And maybe it's more formal, and maybe there are really specific priorities and considerations that you need to take in. But the most important thing to think about this time is don't do it alone, and everyone will be benefiting when you come together. And just like we're doing right now, we can leverage technology to help us. I think that after we've been spending so much time in these virtual meetings, no one's ever going to want to show up around a board table and sit through 2 hours of meetings. So the way that we're learning to be together and to, I think, share some of the deeper things. I know for myself, sometimes the Zoom calls or Facebook calls, we're just talking about cooking or gardening. But now, because we can't see each other, I'm learning to talk about the things that are more important to me, and my feelings and my emotions, which are up and down so many times throughout each day. And the 4th thing to remember is little things make a difference. We can't solve everyone's challenges right now. We can't even solve our own. It's about taking little steps in the direction that we need to go. So if you have ideas about ways that you can help your sister or brother, or help your friends or your community, right now, this isn't just a disability thing. This is what we all need, these connections and these ways of sharing the natural care and the support that we have for each other. So little things make a difference, whether it's if you're out getting groceries and you buy an extra can of apple juice and just leave it outside your neighbor's door. I bet they'll appreciate that. I can't think of anything, not one little thing that we could do for someone else that they wouldn't appreciate. And especially right now, these little gestures just give us that little ounce of hope that we all need. So whatever thought comes to your mind, if it's safe to do it, I'd say go for it. What do we have to lose? And the last piece to remember about this is the majority of people want to help. And before all of this happened, I think we've created these lifestyles for ourselves where we've got to the point where we're disconnected. We in Vancouver, we live in tall condos, we park underground. If we have a car, we go grocery shopping late at night. We don't borrow sugar from our neighbors because we can go to that 24-hour grocery store. We've just lost this feeling of disconnection with each other. But the fact is when we do share our gifts with each other, when we do actively reach out to contribute to an inclusive community, everyone feels better and everyone wants to do that. So during this time where we're all feeling a little bit more isolated, where I don't know about some of you, but I haven't even processed this yet. I look outside and I see the stores outside my window boarded up and I don't see people there, but I haven't even really I think I'm in denial about it. Maybe I haven't really understood what's happening. And so right now, being intentional to form the crowd of people and the team to help us, and just to remember that we do have the ability to build our relationships during this time. There's so many things that we can't control, but relationships, love, caring, natural support, that's something that we can do, and we already know how to do it. And so my encouragement to all of you would just be, go for it, care for each other, and ask for help and ask for support of other people, because I bet they're waiting to hear what's going on with you.
Thanks, Rebecca. That's really lovely. Yeah, and were you going to say something? No? Okay. So, and all that work that Plan's been doing, we've included that in a document that we're going to send out after, so you can read some of the things that Rebecca was just talking about over again, in case you wanted to revisit it. But you know, it all seems like something that's so very natural, but like you said, Rebecca, we've probably forgotten a lot of it just with our modern lifestyle. I'm going to share with you some of the things that I've been doing, and you know, I've already told you that tensions have been running high with no supports, no activities, my increased responsibility, spending more time together, which neither of us really like. And then on top of that all, I find that my brother is scared and confused and worried, which is totally understandable, because I think we've said here a few times now, we all feel that way right now. I also noticed the other day he came down to breakfast. He had some like really dark bags under his eyes, dark circles under his eyes, and he said he hadn't been sleeping very well because he had had a bad dream. So you can imagine, you pile on less sleep on top of everything, it really makes for some hard times. And I'm telling you this all very matter-of-factly and very clearly, but in real life, that's not really how things unfold, as I'm sure you can well imagine. So what that means for me is I've been refreshing some of the work that I've done in the past around compassion and self-compassion. So firstly is really having some compassion for my brother. You know, I think I'm generally compassionate with him, but I looked for ways to sort of deepen that, because small things can make a really big difference, which is something that Rebecca was just talking about. So for example, the tone of my voice has a really big impact. I've noticed that when I change the tone of my voice to a little gentler, a little more caring, it can really change the atmosphere in our house. My brother has a really long history of being very secretive. He's secretive about pain, in particular about pain and any medical problems he's having. I get super nervous when he's not telling me what's going on. And that just comes from the last few years of spending tons of time in hospital. And my brother spent 80 days in rehabilitation hospital. So it was a very anxious experience for me. And sometimes if I get an inkling that something's not right, my own fear overtakes, and I'll say to him something like, "What's wrong?" And when I do that, he'll just shut me down, which is understandable. So I try to change my tone, but also like what I'm asking him. So I've changed from "what's wrong" to like, "how are you?" I notice that when I do that, I do get a more genuine response. Not always. He doesn't always respond even to that, but it does open the doorway a little bit to more genuine relationship. And when he does tell me how he's feeling, what I'll try to do is I'll try to validate his feelings and normalize how he's feeling. And I think, Yona, you were talking about that too. Like yesterday, it was almost like he knew I was going to be doing this online discussion today. Yesterday, he came into my office. I work at home, so he came into my home office and he sat on my sofa and he started to cry. He misses his workers, he misses his activities, he doesn't understand what's happening. So, I was able to say to him, I know you're having a really hard time. I can see it in your face. I know it's really hard for you to take care of yourself all by yourself, and like you miss your activities, you miss being in the community. And I told him, like, everybody feels like that too right now, and I feel like that, and your friends are going to feel like that too. So he doesn't often care when I say that I feel like that too, but I did before that. All the validation of his feelings and the normalization seemed to resonate with him. I mean, there was no big revelation or change, but I did get the feeling that there was some relief in him. And today I noticed he is cheerier than he was yesterday. So, how I say things, what I say, being able to validate and normalize his experience has been really helpful in how we are interacting with each other and sort of reducing the tension that's been building in this time of the pandemic. But there's not only compassion for him, but I feel like I also have to focus on my own self-compassion. I'm, not always a great sister. I'm especially not a great sister in a global pandemic. So I'm fumbling through and getting frustrated and struggling, and I don't often get it right. And I'll yell or I'll say something that I wish I hadn't said. And I'm maybe not giving him the attention that he needs. And I feel badly and I feel guilty. So those are really difficult and powerful emotions. And so what I've done a lot of work on, and what I have learned, is to offer myself some self-compassion at those times. So when I'm feeling guilty for being a bad sister, or feeling badly generally, I'll acknowledge, just like I did with my brother, that I'm having a hard time right now too, and that I'm not the only one, that there's people all around the world that are having a very hard time. And then Yona spoke about mindfulness. So where in my body am I feeling this hard time? And often for me, it's in my chest or my throat. My breathing is compromised in some way. And so I'll go through the steps of mindful self-compassion that I learned through. There's a lot of books out there and even videos that can sort of help you learn this very simple process. Honestly, it's a very simple process, but honestly, I find it a very hard practice, just because self-compassion feels very foreign to me. But it's the only way that I can really be there for my brother and for my husband too, my family, is by really working hard on those pieces. So in lieu of maybe finding a really exciting activity for Paula on YouTube, if I'm just doing a little bit of work on myself, I think the payoff may even be greater. So those are some of the things that I've been working on at this time. We've talked about some things that are potentially really difficult for us siblings. And, if you are finding yourself in any kind of distress, like Rebecca said, reach out to your network. And we're also going to send some information where you can find, like what Yona was talking about, some mental health support if needed.